In this short video, we will learn some basic concepts about the types of metrics or measures in healthcare quality. Measurement is a critical part of quality improvement. As with many other things in healthcare, such as waist circumference, temperature, medication dose, and blood pressure, you can only manage what you measure. A reason we need to measure how things are going is that all improvement is change, but not all change leads to improvement. Measuring separates what you think is happening from what is really happening. We need to make sure that the changes we make do not make matters worse. Measures objectively tell you if the changes you are making are leading to an improvement, and if that improvement is sustained. They help you avoid putting ineffective solutions in place. Measures help you understand how your hospital, clinic, or healthcare system performs at baseline. They help you monitor the effects of improvements and prevent slippage. Dr. Deming, an American statistician who emphasized the role of robust performance measurement, said, "In God we trust. All others bring data." His words speak to the critical role that measuring and tracking data plays in improving quality. Measures used to evaluate and compare the quality of healthcare can be classified in three ways: as a structure, a process, or an outcome measure. This is known as the Donabedian model, named after the physician and researcher who formulated it. Structural measures focus on the physical characteristics of a healthcare setting that enables it to provide high-quality care. Examples of structural measures could be whether a healthcare system uses electronic health records or computerized medication order entry systems, or the proportion of both certified physicians in a clinic, or the ratio of nurses to patients on a hospital ward. Process measures in healthcare are the voice of the workings of the system. They tell you if the parts or steps in the healthcare system are performing as planned. They assess what is done to maintain or improve health and typically reflect best practices and clinical guidelines. An example of a process measure could be the percentage of children with asthma who were dispensed appropriate asthma controlling medications, or the percentage of people with diabetes who had their blood sugar tested. The majority of healthcare quality measures used for public reporting are currently process measures. Outcome measures are the voices of our patient. They let us know if what we did actually changed patients' health status or outcomes. Examples of outcome measures are the percentage of people with hypertension whose blood pressure is adequately controlled, or the number of hospital admissions for children with asthma in the past year, or hemoglobin A1C levels in patients with diabetes. Outcome measures may look like the gold standard measure for healthcare quality. However, we need to acknowledge that many factors could play a role in patient outcomes, such as a patient's baseline health status, lifestyle, poverty, homelessness, or lack of social support. And some of these factors may be beyond a clinician's or hospital's control. In some cases, we can use risk adjustment methods to take these factors into consideration. These methods use mathematical models to correct for specific population characteristics. A fourth type of measure one can use is a balancing measure. This measure looks at the healthcare system from different directions. It assesses if changes made to improve one part of the system are causing new problems in other parts of the system and having unintended consequences. Essentially, balancing measures help us figure out what we are messing up with our quality improvement intervention. If you are trying to reduce your patient's length of stay in the hospital, make sure that what you do does not inadvertently increase your readmission rates. If you are trying to reduce the time patients spend on a ventilator after surgery, you can track if reintubation rates are increasing during the time you implement your quality improvement efforts. If you are trying to increase screening patients with high blood pressure and providing them with appropriate counseling and follow-up, you may want to keep an eye on whether patient flow in clinic is adversely affected. Here are some tips for effective tracking of quality measures. First, plot data over time. Improvement requires change, and change is by definition a temporal phenomenon. Considerable information about a process and how to improve it can be obtained by plotting data over time and observing trends and patterns. Tracking a few key measures over time is the single most powerful tool a quality improvement team can use. The second tip is to seek usefulness, not perfection, in selecting a quality measure. Remember, measurement is not the goal, improvement is the goal. In order to move forward to the next step, a team needs just enough data to know whether changes are leading to improvement. The third tip is to use sampling to obtain data. Sampling is when you select a subset or a sample of individuals from within a population to estimate characteristics of the whole population. Sampling can save time and resources while helping you accurately track performance. Here's the fourth tip. Integrate obtaining measures into your regular routine. Useful data are often easy to obtain without overly relying on information systems. A strategy is to develop a simple data collection form and make collecting the data part of someone's job. Often, a few simple measures will yield all the information you need. Remember, the windshield is bigger than the rearview mirror. Prospective and recent, daily, weekly, or monthly data are much more useful than retrospective data collected quarterly or annually. The final tip is to collect both qualitative and quantitative data. Qualitative data are often easy to access and highly informative. For example, if you are trying to increase the use of a checklist for a particular procedure, you can talk to the nursing staff to understand how the use of this checklist is going and the ideas about how to increase its use. That's all I have for now. I hope that this video has helped you understand how structure, process, outcome, and balancing measures together can help you evaluate the quality of care you deliver and the impact of your quality improvement interventions.